My name is Dr. Farman Ali and I am a GP, family physician. One of the most common type of headaches is migraine. Now, remember, migraine is a condition that causes attacks or episodes of headaches. There are associated symptoms with it, such as feeling sick or being sick. You may get a warning phase, which is also known as the premonitory phase, in which the patient is irritable, depressed or tired. They may have food cravings and they just know that the migraine is going to occur. This is followed by the aura phase, if it happens in certain patients. This is followed by the headache phase and eventually the resolution phase, when the headache gradually fades away. Typically, the headache of a migraine without aura can last between 4 and 72 hours. A distinguishing feature is that between migraines, the symptoms will completely go away. So what causes migraine? There are many theories that have been proposed. One of the most common one is that the blood vessels in parts of the brain become narrower or go into spasms, which accounts for the aura part of the headache. The blood vessels then are thought to open up or dilate, and this accounts for the headache phase. Another theory is that some chemicals in the brain increase in activity, and parts of the brain may then send out confusing signals, which causes the symptoms. Menstrual migraine is thought to be due to the fall of estrogen that occurs at this time in the cycle. Estrogen is one of the chemicals or the hormones that controls the menstrual cycle. So we come to the symptoms of migraine. Typically, migraine is at the front or the side of the head. Sometimes it is on both sides of the head. The pain is described as moderate to severe and is often described by the patient as a throbbing or pulsating pain. Typically, it gradually becomes worse and peaks somewhere around 2 to 12 hours and then gradually eases off. The duration of the migraine can last between 4 and 72 hours. As mentioned earlier, feeling sick or being sick is also an associated sign of migraine. Patients do not like bright lights or loud noises, so they might like to lie down in a dark room or try to sleep it off. There are two types of migraine: migraine with aura or without aura. Visual aura is the most common type of migraine aura. It usually affects just one side of your vision and gradually gets bigger over the next 5 to 20 minutes. Examples include a temporary loss of vision or part of the vision, a bright shimmering light, often in a C-shaped pattern, a bit like looking through an old-fashioned kaleidoscope, or some patients may describe it as zigzag lines. Objects or letters on the page may seem to rotate, shake or boil. Other types of aura include numbness or pins and needles. This is the second most common type of aura. Numbness usually starts in the hand and travels up the arm, involves the face, lips and tongue. Occasionally the leg may be involved. Problems with speech are the third most common type of migraine aura. Other types of migraine aura include odd smells, food cravings, a feeling of well-being, and other odd sensations. One of the migraine auras may develop, or several of these may occur at the same time. Each aura usually lasts just a few minutes before going, but can last up to 60 minutes. Remember, with all these type of auras, do not forget the signs of stroke. So what are the triggers of migraine? Different patients have different triggers. Diet is one of the common triggers. Dieting too fast, irregular meals, cheese, chocolates, red wines, citrus fruits, foods containing a substance called tyramine is also known to cause migraines, and not drinking enough water, dehydration. Environmental factors such as smoking or living with a smoker in smoky rooms, glaring lights, screens or flickering TV sets, loud noises and strong smells in the surroundings. Psychological: depression, anxiety, anger, tiredness or stress. Many people with migraine cope well with the stress but have attacks when they try to relax. Hence we call it the weekend migraines. Some of the medicines, for example the HRT, sleeping pills and certain contraceptive pills. Periods or menopause can also have effect on migraines. Shift work and a changing sleeping pattern is also known as the trigger of migraine. Does migraine occur in children? Yes, it does. Migraines is common in children. It can affect 1 in 10 children of school age. The symptoms can be similar to those experienced by adults, but attacks are often shorter and pain may be in both sides of the head. Also associated symptoms in children include nausea or vomiting. You may have heard the term abdominal migraine. This mainly occurs in children. Instead of headaches, the child will be complaining of tummy pains, which lasts several hours. There may be associated sickness or just the feeling of sickness. Commonly, children who have abdominal migraines, they tend to have common migraine in their teenage years. The triggers in children include missing meals, lack of fluids, dehydration, or irregular routines. Many of the medicines that are used by adults are not licensed for children, so general measures are the best way to start. Migraine when pregnant or breastfeeding. The good news is that about 2 in 3 women with migraine have an improvement whilst being pregnant or breastfeeding. However, 1 in 20 women with migraine find their migraines get worse while pregnant. Bad news is that many of the medicines that are used to treat migraine should not be taken while being pregnant or breastfeeding. Other types of migraine which are less common, they include the menstrual migraine, as I mentioned at the beginning of the presentation. Menstrual migraines are migraines with or without aura, and it is at the timing of the migraine that makes it menstrual migraine. Ocular migraine, sometimes also known as retinal migraines, ophthalmic migraines, or eye migraines, cause a temporary loss of all or part of the vision in one eye. Hemiplegic migraines, this is rare. In addition to a severe headache, symptoms include weakness, like temporary paralysis of one side of the body. Remember, if any such red flag signs occur, you should refer the patient for assessment so that stroke can be ruled out. Vestibular migraine. It may affect up to 1 in 100 people. It causes episodes of severe dizziness alongside typical migraine symptoms and lasts between 5 and 72 hours. Another type of migraine, basilar type migraine. This is thought to be migraine originated due to problems in the basilar artery in the brain. So what is the treatment for migraine? Paracetamol and aspirin both work quite well for migraine attacks. Take a dose as early as possible. If you take painkillers early enough, they often reduce the severity of the headaches or stop it completely. Some people do not take painkillers until the headache fully develops. This is often too late, and the painkillers do not work as well. Aspirin, as I mentioned, it's basically an anti-inflammatory. Recently, we are not using aspirin as often, or it's not one of the favorite treatments for other conditions. However, it is still very useful for migraine. It is best not to use codeine and medication containing codeine such as cocodamol to treat migraine. This is because codeine can cause sickness and vomiting, and with migraine you already have nausea and sickness, which can make matters worse. Non-steroidal anti-inflammatory drugs, or simply known as NSAIDs. These anti-inflammatory drugs, they include the ibuprofen, which you can buy over the counter from any pharmacy. However, for other types such as diclofenac and naproxen, you need a prescription from your doctor. Remember, patients with asthma, heart problems, stomach and kidney problems, or if the patient is pregnant or breastfeeding, should not use anti-inflammatories. Ideally, an anti-inflammatory medicine is taken with some food or milk, and that reduces its impact on the stomach lining. Sometimes your GP may prescribe a stomach protection tablet such as omeprazole or lansoprazole. One brand of ibuprofen dissolves in the mouth and may be swallowed with the saliva. This makes it easier to take that tablet if you're feeling sick. Nausea and vomiting is common in migraine. So, what should we do? You can use soluble, dissolvable painkillers. They are absorbed more quickly as compared to the ones from your stomach and are likely to work better. One brand of diclofenac comes as a suppository. This may be useful if the vomiting is very bad. You can take anti-sickness medication in addition to the painkillers, for example, domperidone, prochlorperazine, or metoclopramide. Some brands of migraine tablets contain both a painkiller and anti-sickness combined together. Triptans. Triptans are not painkillers, but triptans work by imitating the action of a chemical called a 5-HT, also known as serotonin in the brain. There are many different types of triptans available. Sumatriptan, this is also available as an injection. Rizatriptan and Solmitriptan, which are available as a wafer or a tablet, and they disperse in the mouth, and then it can be swallowed with saliva. Zolmitriptan and Sumatriptan are also available as nasal sprays. You should take the first dose of your triptan when the headache is just beginning to develop, but not before that. If the triptan worked to relieve the headache, but then the headache returned later, you can repeat the dose after 2 to 4 hours. Triptans are contraindicated and should not be taken by patients with high blood pressure, risk of angina or heart attack, those with a history of stroke or mini stroke, those patients who are pregnant or breastfeeding. How can we prevent the migraines from coming in the first place? Keep a headache diary. The benefit is twofold. First, it gives you the triggers that you can identify and try to avoid. Secondly, it also assesses the efficacy of your preventative treatment. So when can you start prevention medication? If you are getting 2 attacks per month that cause significant disruption to your life, you can consider preventative medication. If you have less frequent attacks but they are very severe, you can consider preventative medication. If there is a need of a lot of painkillers or Tryptan medicines to treat your migraine attacks, your doctor may consider prevention. If the painkillers or Tryptan medications are not working very well, or you're unable to take them because of the side effects, you may consider preventative medication to stop the headaches from coming in the first place. Remember, there is always a risk of medication overuse headaches, and your GP may consider giving you preventative medication. Menstrual migraine, which cannot be avoided, sometimes requires preventative medication. So what medicines are used to prevent migraine from coming in the first place? Beta blockers is the most commonly used, and these include the propranolol, atenolol, metoprolol, timolol, and nadolol. They are used primarily for treating heart conditions and high blood pressure. However, most commonly propranolol is used to prevent the headache from coming in the first place. They should not be used by patients who have asthma or peripheral vascular disease. Anticonvulsants. These are medications such as sodium valproate and topiramate. They are used for prevention of seizures of epilepsy. However, we found that they were very useful in preventing migraine attacks. Amitriptyline is also used. This is primarily an antidepressant, but in this instance it is used at a low dose of 10 to 20 milligrams at night to prevent migraines. Other medications have been tried, and they include prizotafin, gabapentin, some blood pressure medications, and occasionally some antidepressants. Botulinum toxin or Botox injections to prevent migraine. Now, this is given as a treatment of 5 courses of treatment of Botox injections every 12 weeks. These injections are given into the muscles of the head and neck. NICE recommends Botox can be used as a possible treatment for preventing migraine in some adults with persistent chronic migraines. The criteria set down by National Institute of Clinical Excellence includes: if you have chronic migraine, if you have already tried at least 3 different types of preventative treatments and they have not worked, and you are not taking too many painkillers or using them too often. Thank you very much.